Ozempic, Wegovy, GLP-1 drugs, the magic weight loss drugs. Yeah, what about them? Dr. Yoshiram here with Voice Family Medicine. And, I've been asked a lot about these drugs over the past year, especially, starting a little bit before a year ago. But wanted to share my opinions about them. A year ago when people asked me, I wasn't so sure because, frankly, I don't think we had the longer studies on them at the time in the weight loss dosages. They've been around for a while, but it's been for diabetes and blood sugar, versus then they jacked up the dosage to stimulate weight loss. And so, I don't want to be natural just for the sake of being natural. I want to be a little bit scientific about this. So my answer was honestly I don't know. Let's see where this goes. I kind of have maybe a bad feeling about this, but time will tell. Then probably maybe just under a year ago, started to become clear to me that I think for someone who is truly obese, these drugs can be a godsend, honestly. So many individuals who are way overweight have tried so many different things. It can be so hard for so many different reasons. There are serious health consequences to being obese or way overweight. I'm not talking 5, 10, 15 pounds overweight. I'm talking truly obese. And so for those individuals who, for whatever reason, are unable to lose a bunch of weight, 50 pounds, 100 pounds, 200 pounds overweight, that is seriously not healthy, and that will have a major health impact. And so if there's a drug that can take off a very good chunk of that weight, more power to you. So I think there's a time, like I always say, there's a time and a place for everything. These drugs are not bad. Again, they're not bad. They're also not good. It really depends on the situation that we're looking at. So again, just to be clear, if someone's way overweight, it makes sense to use these for a time period. And then possibly for a long time, depending on someone's metabolism. And the hope would be to lose a bunch of weight and kind of get to a steady, a much healthier, steady state, and then maybe bring the dosage down to a much more healthy dosage. There's a lot of side effects. You can Google the most common side effects, but my main issue with these is that when people are on a high dose, i.e. a weight loss dose of these drugs, people lose fat, but they also lose muscle. Well, I usually tell my patients that what's the muscle of longevity? Any ideas? It's muscle. Obviously, there's a lot of organs. Did I just say that right? What's the organ of longevity? Did I say what's the muscle of longevity? I don't know. I can't remember. Anyways, what's the organ of longevity? Muscle is the answer. That's what I usually say. There's other organs of longevity for sure, but I think it has a nice pop to it. And it's true, as we age, when you look at people who are the elderly who are going to pass away soon, it's a large portion of the reason is because they don't have enough muscle. Don't have enough muscle to keep balance, don't have enough muscle to move well. So they end up falling over, breaking a bone. If they don't die soon thereafter, it is, within 6 months of breaking a hip is one of the more common ways to die. And so muscle is, again, the organ of longevity. I'll kind of dumb it down or oversimplify it and say, again, muscle is the organ of longevity. And so what happens with these weight loss drugs in high doses, you're also losing about a third of the weight loss is actually in muscle, and that's not good. And so there are ways to overcome that, though, and that involves getting enough protein. I love, good quality protein, but also in our office we have Perfect Aminos, which is just amino acids, but it's the essential ones. So a very small dose can actually equal a huge, like a small dose of those can actually equal like the amount of protein that's in I don't know, half a steak or a piece of chicken or fish or egg, whatever. So that's a really fine way, very clean way to get in extra protein. And so working out, working the muscles and getting enough protein and amino acids on board while on one of these drugs is super important. I think that could take away almost all of the major side effects. You know, the other side effects of like nausea, well, you know, if you are desperate enough, and again, sometimes desperate times call for desperate measures, so no judgment there, but that's not gonna be super unhealthy unless it's for a long time, obviously. However, what I will say is fasting in a wise manner really does the same thing that these weight loss drugs do. It's also a lot cheaper, free. Actually, you end up saving money because you're not buying food. So there is a right way to fast, a wrong way to fast. I'm not going to get into that right now, but just wanted to throw my thoughts out there. I haven't covered all of them, but these are my main kind of core things for people to think about. And again, I'm going to throw this out there because I've been asked a lot about these drugs, understandably, over the last couple of years. So again, these drugs are not good, they're not bad. It completely depends on the situation that someone is in. Hope this is helpful. Take care.